Hi, my name is I am Ganekahaga from the Mohawk Nation of Ganawage. I am here to interview Dr. Bell to discuss where we are with COVID and some COVID questions. So pass it over to Dr. Bell.
Hi, everyone. My name is Dr. Shaquita Bell. I am a pediatrician in Seattle, and I am happy to talk about COVID since I do it every single day.
I'm so happy you do, and I truly applaud the work you're doing. I write fart jokes all day, so I'm not contributing much to.
I talk about poop all day, so we can go there. It's all right.
Okay. What I heard from that is that you think I'm a doctor at this point.
Yeah,
so
it's basically the same thing. Yes.
Oh, great. I'm going to dive in then, if that's cool, with some of these questions.
Wonderful.
Number one. So about 40% of adults in the United States population is vaccinated. Do people still need to wear a mask and practice social distancing?
Great question. First of all, thank you to everyone who's had their vaccines. I think it took a lot of us being brave and doing stuff for our community and our family to step up and be vaccinated. And for those of you who are still thinking about it, considering it, have questions, thanks for tuning into this. It is very important to still be vaccinated. 40% coverage does not equate to coverage for all of us. So that's not enough people to really keep our community safe. So we still need lots more people vaccinating. And we have to remember that many kids are not able to get vaccinated, right? Only children under or over the age of 12 can be vaccinated right now. So in order to get that percentage high enough, we need us adults to be going in and getting stuck.
Hey, love it. On the topic of masks, I grew up in a very frugal family and spent a whole lot of money on a whole lot of nice looking indigenous masks. How long can I still wear them?
Great question. I love a good stylish mask, especially if it's effective. And I love that it's become a new fashion accessory for people to speak their minds. You know, masks are still really important, especially indoors. If you're in places like airports or shopping malls or the doctor's office, it's really important to still wear a mask. To remember, like I was saying, that not everybody's able to be vaccinated. Kids under 12 and people with immunocompromised systems are not able to be vaccinated right now. And so in those small indoor places, we know that COVID is more likely to be contagious and spread. And so we still want you to wear your mask. So it's important to mask up on inside. And then outside, you know, the CDC guidance is really that we could go without masks if we're vaccinated and or if we're able to stay 6 feet away from people. The evidence of spread outside has been pretty low, so it's a relatively safe place to be without a mask as long as you're able to keep a safe distance from people. So no TP creeping without your mask.
Loud and clear, loud and clear. I just wanted to know if there's a world where people respect the line at like the good fry bread truck, or should we like abandon hope?
No, as long as my cousin's working, there is no line.
You go straight to the front, I presume.
That's right.
I love it. So next question. Recent reports said that we're unlikely to reach herd immunity. What does this mean exactly, and how does this change the outlook for the future?
So herd immunity is such an interesting term. We are not talking about deer or buffalo. We're talking about this idea that there's a certain number of people in a community that need to have immunity in order to keep everyone safe. And so one of the things we think about that a lot with is, for instance, measles. So not everybody can be vaccinated against measles. Again, new babies cannot get the vaccine, and people who have had organ transplants or have immune systems that it's not safe to get vaccines cannot have a vaccine, but we protect them by being vaccinated ourselves so that the infection can't really spread from person to person. So herd immunity is just that magic number where the vaccinated people outnumber the infectivity of the infection. So it cannot infect people who are vaccinated, and we outnumber the people that are not vaccinated. The other way to think of it is it's usually sort of a 70-30 rule or an 80-30 rule. So if 70 or 80% of people are vaccinated or immune or cannot catch an infection, then that infection can't really spread from person to person because there's enough of us who won't carry it to somebody else.
Mm-hmm.
I think the reality of whether we'll get to herd immunity with COVID is actually too soon to call. I think there are some people saying that we won't reach it. Of course, you hear people saying we will reach it. I really think, coming from an Indigenous community, that I believe in the power of each other, and that we're going to take care of each other, and that we're going to do what's right for the greater good and the greater community, for our elders and for our next generation. So I think it's achievable, especially if we all commit to getting our vaccines and commit to washing our hands and wearing our masks indoors and doing the simple things that can really keep us all safe. I believe that we can get there or get pretty close where we have a better control over this infection and we can do more to prevent people from getting it.
I love that, because my future entails eating a violent amount of food at powwow. Obscene amount. And the sooner powwow can get here, the sooner I will be at peace. So I know my reservation's not having it this year, unfortunately, but I am very hopeful for 2022. And I do have to ask the professional question, do you have a favorite herd? Caribou? Moose?
Actually caribou, that would pick caribou. I do like a good moose, but they're kind of intimidating. So yeah, I think I'd go with caribou. It's a fun word. I like caribou coffee. No plug. I don't get sponsored by them, but
Respect. My dad, my father was a health administrator in Northern Quebec, and the caribou herd outnumbered the population by about like 40,000, something crazy. And my mom always called moose drunk elephants. So
that's such a great, yes, that is a great analogy. Yes. Yes, especially when they're scary into your car or your house. Yes.
I was never scared of moose growing up until the time I saw one from behind the wheel of a car. That's when it got real.
Yeah, that's not okay.
All right. Next question. How are these vaccines developed so quickly, and did vaccine makers or the government cut any corners?
Oh, such a great question. I have to be perfectly honest. It's a question I had myself. It was something that concerned me as a scientist. I'm like, how do you make something so quickly? I've done a lot of studying of this, and I've actually talked to a few people who actually create vaccines. And the reality is the technology of mRNA, which is essentially what is carrying this vaccine in Pfizer and Moderna, has been around for a long time. We just had not chosen to operationalize it for this use. So if you think about it, existed, we knew a lot about it for decades. And this was the opportune time where a scientist said, why don't we use this tool that we've developed and we've studied in all these different ways to try to create a vaccine for this infection? So the short answer is no, there were not corners cut, in that this was good science, that people like myself volunteered to be in vaccine trials. So I'm in the AstraZeneca vaccine trial. So we allowed people to study our blood and to see how the vaccine reacted on us so that we can then deliver it on a population level. And that's the science behind vaccines. So you develop one based on what the infection is, and then sample it in people who are willing to volunteer. And then as long as that is safe and effective, you can scale up to more and more people. The other two vaccines that are commonly talked about, the J&J and the AstraZeneca, do involve a little bit different technology. But again, all of these processes, all of the ways that we've made these vaccines are ways that we've used for years to do medicines and to do science and research. It's the COVID part that was new. And ironically, while COVID has been so destructive as an infection for our global community, the idea of an infection is not new to us, right? And especially to our indigenous communities. We've seen influenza, we've seen tuberculosis, we've seen smallpox. We see these things come through our communities, and we know, we have this shared collective knowledge that we can overcome these infections. And I just think of tying that shared knowledge with some of the research that's already been done and bringing it together. So no shortcuts, no secrets. I think the work has been really inspiring. There are folks who worked around the clock with no breaks to make sure that we could provide some sort of cure, some sort of prevention, some sort of end to this cycle that we were in for the pandemic. And I'm so thankful to all the people who did that.
It's truly incredible. I want to know too, like, are they going to just as quickly develop a guide on how to talk to people again? Because I completely forgot. My social skills are gone. I forgot my name last week, and I forgot my name of the person I was talking with on the phone. That person was my mom. So I'm doing great.
Well, as a doctor, I can tell you, it sounds like you need a little less screen time, a little less multitasking, a little bit more focus. Maybe de-technology eyes yourself.
I am guilty of doing the midnight scroll on the phone, on Twitter's, Instagram, the whole thing. Yeah, I added an S to Twitter because I am over the age of 30 now, and I feel like I could do that.
Well, Tai, I will say, a lot of people are worried that, like, I don't seem to remember things as well. I seem to get confused, or I have trouble paying attention to things. And we think that is a pretty collective experience. A lot of people all over the world are feeling that way. And a lot of it is this. So we've been staring at computers and phones and screens pretty much nonstop for 12, 13 months. And a lot of it is that we're not having new experiences per se, right? Our body, our mind, we're not feeling, smelling new things every day. So that's really changed our brain connections. But the good news is we can unlearn that. And we can definitely, when we start to make more social connections and get outside and be together, we will definitely become humans and not robots again.
I can't wait. I'm full on Matrix right now. It is like, it's not a good look, but I'm getting better. I will say. I guess I'll go to the next question. This one is in regards to variants, because it seems like there's a new variant of the virus popping up all over the world all the time. So what are these variants, and will the vaccines work against them?
That's a great question. So in talking about how we make vaccines, how we study the virus itself and use the vaccine technology or the science of the vaccine to create immunity, the infection itself almost has a sort of intelligence. So the virus says, oh, if I change this one little thing, then I can go farther when you cough, or I can infect more people when I'm around you. And so the virus is sort of learning without actual intelligence, but with DNA and pressure to survive, it is learning how to be more infectious. And so that's what we're seeing with the variants. The virus makes a little change, and it turns out that change is really successful for it spreading more. And so the variant that does spread more, it gets to be reproduced more. And sometimes it makes a change that makes it less effective, and we are able to stomp it out because it's more vulnerable. So right now, all of our vaccines are protective against all of the variants we've discovered. Now, what's not clear is how long the immunity from the vaccine will last. So we don't know that if you get a vaccine like I did last November, if I'm still going to have immunity November of 2021 or November of 2022 or November of 2023. And so there is a possibility that we might need the vaccine booster, kind of like you had when you were a kid, when you go in and get another shot to remind your immune system to keep building antibodies. We might need that, but right now the vaccines are protecting against the variants, which is very good news, because that will continue to make the variants less successful in spreading and will continue to save people from getting COVID. The other thing I was going to say is the robot look's not a good look, but the COVID look is also not a good look.
Very true. Very, very true.
I mean, I've never seen a stylish intubated tube.
No. I have no desire to ever try that out.
And you know, the blue toes, purple toes, that's not a good look. Nobody wants.
It's not a good look. It's not a good look. Purple nails belonged like in 1993 for about 5 minutes. And that door shut pretty quickly.
Yeah. I wrote it hard, but yeah. I gave it up. Hey,
Nirvana was going strong.
That's great. That's a good Seattle reference there.
That's the only one I have.
Gotcha.
No, that's not true. Who can forget Real World Seattle?
Oh God, I think we all should forget Real World Seattle.
Iconic television.
Yeah. Well, let's just say I was a teenager in the 90s. Suffice to say, you don't need to know exactly what side of teen I was, but yeah, I had purple carpet, purple walls, purple bedspread. My parents, bless them.
Hey, you blame it all on Prince, if anything.
That's right. Hey, good Minnesota reference. That's where I'm originally from. So I like it. Shout out. Yes.
Oh man. These are truly all organic, and I feel pretty good at my job.
You're really knocking it out of the park. You're batting 100 right now.
I'm trying my best. Speaking of variants, so the gist of it is that like they're kind of like annoying cousins.
That is exactly it. Yes, that one or two annoying cousins that somehow always hear about the family reunion or the barbecue, and you're like, I told you not to invite them. That's
or 8 or 10 cousins. Yeah.
Right.
Yeah. I very much come from a very large family, and I'll just say it now, Eric, I did not burn down your shed. Thank you. All right. Next question. Question number 5. Which vaccine is safe for children to receive, and what is the difference between the vaccines?
That's a great question. So first of all, I'm going to change the word from safe to approved and studied, because the vaccine that's been has been studied, and then that information has been shared with our federal government and our scientists, like at the CDC, is the Pfizer vaccine. But I will say that in the US and in other countries, all of the vaccines are being studied on children. So I mentioned that I am a vaccine study participant. So I went in last fall and had my blood drawn, and I got a placebo or a vaccine. And then I don't know why I did that. Bunny ears. I got a placebo or a vaccine, and then they continue to study my blood. So people have been willing to have their kids participate in those studies all across the world. So right now, the vaccine that's been studied the most and whose science has been approved is the Pfizer vaccine, and that's approved to age 12 right now. There are trials going down to the age of 2, and we expect from the FDA probably to have approval at the end of the summer, beginning of the fall, for Pfizer, at least in the US. Now that is probably going to vary from country to country. So places like Australia and Europe, Mexico, South American countries will each have their own process for adopting these vaccines and deciding what age they're approved at and what science is sufficient for them. But for instance, in the US, the FDA and the CDC, folks like Fauci, take a look at what the companies that are developing these vaccines have done to study them in children, and then decide whether that information is enough to approve it for being a safe vaccine in children. The other thing that I like to remind people is the COVID vaccine is really different than our routine childhood vaccines, because it's still under what we call an EUA, or an emergency use authorization. That means we really need to have a conversation both with the child and the parent or guardian to say, hey, here's what we know. You know, we know COVID is really bad for all of us, but especially bad for older adults. And we know that this vaccine has been studied in a couple of thousand or a couple of tens of thousands of people, but we don't know everything, right? We don't know what's going to happen in a year or 2 years or 5 years. So we want to make sure that people get informed consent. And that's something that's not always happening happened in the US, and certainly not to our communities, that we have been given false information or people have not shared accurate information with us. So this process of the EUA is really a governmental level decision of saying everyone who gets this vaccine needs to be informed, needs to have a choice. It needs to be our choice to get this, and we need to understand what that choice means. I don't know whether the US, for instance, is going to approve any other vaccine for children, but right now the Pfizer vaccine is what we're using, and it's been very effective. I have state level data in Washington to show that it's virtually 100% protective for children under 18. And it seems like the side effect profile, even the being sore and having some aches afterwards, is a lot lower than adults. So it turns out that kids are, or maybe adults are wimps and kids are super strong. But it's really great to see that kids are really tolerating it very well.
That's incredible, and I wouldn't put it past them. Was I dropped on my head as a child? I will not publicly disclose, but I am here and I'm talking and doing good. Also, I'm very excited for this next the next part of vaccinations, only because I haven't seen a tiny tots competition in 2 years at a powwow, and hurts the heart. Yeah, it hurts the heart.
Yes.
Okay, so I'm going to go to my next question, which is sort of, can you explain the newest CDC guidelines on masks?
Oh,
and is it 100% safe for us to walk around without masks right now?
This is such a loaded question right now. I think if I'm going to be honest, I'm going to share just from my personal heart, from myself, and from what I am doing with my family, is I am wearing vaccines when I am indoors in public spaces. So I'm not wearing masks at home, for instance, but if I go to the grocery store, I go to the gas station, when I come to work here at my clinic, I'm going to wear a mask the whole time unless I'm on a Zoom call with the famous Tai. If I'm outside, because I'm vaccinated, if I'm outside right now, I'm not wearing a mask unless for some reason I'd be really closely, like shoulder to shoulder with somebody. But if I'm out for a run or a walk, really a jog, let's be honest, I'm not wearing a mask. I have it with me in case something happens. But I don't plan on wearing it outside, since the data is so favorable for people, especially people who are vaccinated, that the risk of acquiring COVID is really, really, really low. It's almost zero outside, and it's really low, period.
That's great, because I was like, so I'm vaccinated. Say I'm walking to my auntie's house and I only have to pass two other houses and maybe like 12 res dogs. Do I need to wear a mask?
Probably not. No. I mean, we don't know if res dogs can carry COVID yet, so maybe don't get too close. Don't.
Res dogs are resilient.
For sure. Yeah, they are resilient. They might be the origin.
They might be the origin and the cure.
Yeah, and the cure. Exactly. I will say, if I'm going to go visit an elderly family member of mine, I usually will have a conversation with them. What are you comfortable with? What would you like me to do? I don't I think your personal vaccination status is your information. But if you're visiting with your family and you love them, I think it's worth having a conversation. What do you feel comfortable with? Here's what my thoughts are. And I think that's really the best way forward. I know that a lot of people don't agree with the CDC recommendations on masking, and I don't pretend to tell people how to think or feel. I think we all get to make the decision for ourselves. I think the important part, and what we've learned, especially in the last year, is we shouldn't police other people. We should make a decision about what's right for us. And if you don't feel comfortable, you can put your own mask on. And if you do feel comfortable, you can take it off. And that's the beauty of personal freedom, and of being able to make an educated and informed decision.
I love that. For the record, I am vaccinated. I got the Johnson & Johnson vaccine, and the only disappointing aspect of it was there was no Howard Johnson discount plugin. I got free fries at Shake Shack, but I want more.
I want some free baby shampoo. Tier free.
Oh my gosh. Tier free. Tier free. That we could put in air quotes.
Don't you squirt it in your eyes? Isn't that how you clean your eyes? Wait, that's not doctor recommended. Walk that back. I'm just kidding.
We'll rewind a little bit, do a funny sound on the way out, and just do two big things up on the screen.
Yes.
Love it. So next question is it's a little bit of a tough one but you sort of spoke to it recently. What is your advice to talking to friends and family who are hesitant to get the vaccine?
Yeah, I mean, I think this is something I do every day. And the first thing I want to do is respect them as a person and their decision and say, just I want to understand, or is it okay if we talk about this? Would it be okay if we discuss it? I think getting permission is nice. If it's my little sister, I'm gonna force the conversation. But if you feel like you already feel like it's difficult, or that maybe you don't have the same beliefs or thoughts or viewpoints, I think it's okay to ask permission to have a discussion, and then really try to help understand. Is it a fear? Is it misinformation? Is it just not being ready? What are the motivations for your friends or family who are hesitant, and help people understand that you can even still be hesitant and get the vaccine, right? You can still not be sure. Just because you get the vaccine doesn't mean you think it's going to be perfect and that there are no problems and that the world is going to just be perfect tomorrow. You can still have questions and be unsure and choose to get vaccinated. I think I also just try to help people weigh the risks and benefits, understanding that your decision doesn't just impact you. It is your decision to make, but your decision also impacts everyone around you and our greater community. And to me, I view it as something that I'm doing for others. It's why I joined the vaccine trial. I wanted to have Indigenous people represented in this vaccine work and in this study. And so I said, I don't have kids. I'm a physician who's already exposed to COVID. I want to give this to others so that we know that these vaccines are safe for us. And that was my choice, but I don't expect everyone to make that choice. But I do want to help people be informed. And so like the conversation you and I are having, being able to answer people's questions. If I don't know an answer, looking it up together. I mean, somebody asked me once, well, I had a really bad reaction to the first dose, and I don't know if I want to get the second dose, and what are the risks of side effects from the second dose versus the first dose, or how protected I am. And that's not stuff I can just pull off the top of my head. That's like asking me my locker combination from 5th grade. I don't remember, but we can pull up the page together. We can go to the homepage of the vaccine, or we can go to the CDC or the FDA. Some of our tribes have information on their websites, and we can look for those answers together and make sure we feel like we're getting them from a trusted source. So, it's much like everything else in having hard conversations. I think we seek permission, we give grace, and we bring patience.
Great. And most importantly, does friends and family include your cousins' or just your cousins?
Well, it depends. Do they want money or food, or
if they we know the answer to that question. Yes. Thank you for that. Thank you. That was my top notch. Like if I had to get one of these questions tattooed, it was that. Okay, one more big question. As more and more people start traveling again, what are the best practices people should follow to stay healthy?
Yeah, I mean, first of all, just like any time, I think travel should be something that needs to happen, right? Like, I think you want to think about what's the safest way to do what you need or want to do. So I think one of the benefits of COVID, if I'm allowed to use that word, is that we saw that some of the impacts to the planet have been really phenomenal. Our cutting down on using things like fossil fuels and jet fuels has been so good for our planet that I think it's a great time to say, do I need to get on an airplane? Do I need to get in a car? Do I need to get on my horse? What are the impacts of this decision I'm making, and why am I doing it? If it's going to see my family that I haven't seen in 15 months, and I want to love and hug and be with them and have ceremony or spend time together, I think that's definitely a great reason to travel. If you're like, hey, I'm bored and I've been working too much, maybe you think about something that you could do that's less impactful to the planet. The other thing to remember, once again, I'll keep saying this, is not everyone can be vaccinated, and some of those people do have to travel, right? If you have a compromised immune system and you need to go to another location to get some of your care, you have to get on a plane. I think it's only fair that I try to do my best to keep you protected as well, and vice versa. So I think some of the precautions are wearing a mask at all times, especially if you're in the bus station, if you stop for gas and need to go into the gas station, if you're in the airport or on the airplane, is always wearing your mask. And that's not just for you, but that's also helping to protect everyone else. I recently went home to see my family for those very reasons. I really wanted to visit with my parents who are now vaccinated, so we could hug and kiss, and I could also eat my dad's fried chicken. And I brought some hand sanitizer, and I wiped down my seat before I got in it, and I was really careful to keep my mask on the whole time unless I was taking a drink of my water. So some of the things we're already doing, right? When we go to the grocery store, we're not like, this peanut butter is good, or
not anymore.
Not anymore, right? So it's the same principles, just bringing that awareness to you around travel.
That's great. And is the bed of a truck with 5 of your coolest friends the best method of travel?
Well, officially as a pediatrician, I would say absolutely not if you're a child. And if you're an adult, that's not my job.
Respect. That's the answer I was hoping for.
It is one of the more fun ways to travel, though.
Oh my God. Blast all the music you want. Just as long as someone's driving, you're golden.
That's helpful.
You're golden.
Yes, driving while facing forward. That helps a lot.
Fingers crossed. I mean, I can't ask for the world. All right, we're gonna do some lightning round questions if you're cool with that.
Okay.
Some are different than others, so I want to see how on your feet you are. This might be a little bit of a lightning round quiz section. All right, are you ready?
I'm ready, I think.
All right, question 1. How much does the vaccine cost?
It's free.
What is my favorite food?
Fry bread.
I'll take it. Do you know how I can become best friends with Buffy St. Marie? You just seem kind of well connected.
Oh my gosh, I wish I would. I'm on the list too. Let's maybe combine forces. No, I don't.
I feel like you're ahead of the list more than I am.
I'll bring you with, Ty. I'll bring you with. We'll sneak in together.
I love it.
I'll wear a muumuu, a very flowy caftan, and we can just.
I'll bring a guitar. It'll be a party.
There we go.
Question 4, true or false? Do I look good in a denim jacket?
True. Everyone looks good in a denim jacket.
Right answer. If I had COVID, should I still get the vaccine?
Yes, you should. And no longer, you don't have to wait. You can go and get it now as long as your symptoms have resolved.
I love it. Should we as Native and Indigenous people adopt all of the members of Slipknot?
Definitely not. I'm not down with that music genre.
Ooh, controversial statement. That's what we want in this interview. We want controversy. We want the comments to be lit up.
That's right.
Next question. Does an apple a day keep the doctor away?
No, but we do love apples. They're really good for your teeth, but
are they?
They're not enough. We like vaccines. We like preventative health care. If you're sick, you should come see us. But great. Apples are great.
Great. Next question. What's 5 plus 4?
9.
Great. Is there such thing as too much hand sanitizer?
Not on your hands, but you should never drink it.
Great. Okay, I will stop that now. Your best friend decides to have a last-minute bonfire in their front yard. What snack are you bringing?
Probably s'mores. It's like, if you don't like the marshmallow, you just eat the chocolate. You've got the crunchy and the sweet and the soft. Yeah, s'mores. That's the way to go.
You are the people's doctor. I love that. I love that. I have some sort of long form final lightning round questions, if that makes any sense.
Okay.
All right. Number 1, I bought a healthy amount of jewelry, beadwork, and clothing from incredible indigenous designers all during quarantine. How soon can I myself sneak into Grand Entry at Powwow and do a full-on catwalk?
Well, I would like to be front row, so let me know when we're going. My guess is that we probably will have to wait until at least 2022, maybe the fall of 2021. But let's be honest, nobody has a magic 8-ball with COVID, and we all thought it was going to be done in a couple of weeks. So I'm not making any promises.
Respect.
Today. You can't do it today.
Okay, that's a good enough answer for me. Personal anecdote, when this first started, I was working in LA, but lived in New York. So I flew to New York and left my rental car in a parking lot, thinking I'd be right back. I did not come right back, and I paid a whole lot of money to return that car. I wish that on no one.
Speaking of jewelry though, in my community, if somebody gives you a compliment on your jewelry, then you have to, or then you're supposed to gift that jewelry to them. So I just wanted to point out that your earbuds look really nice.
Oh, great. Yeah, I see how that works. Wait till I pull up my card. All right. I'm gonna hold on to something for later.
All right.
Okay. Next question. Is one vaccine more bougie than the other? Because all my friends who got Pfizer won't stop talking about it. Am I a loser for getting J&J?
You are not a loser for getting J&J. I'm sure that there are some opinions about bouginess of the vaccines, but I will tell you, they all look the same in the syringe. So it is not one is better than the other. It is not one is cooler or more expensive. They're all free and they all work. So whatever you have access to or whatever you feel comfortable with, I would strongly encourage you getting.
That's great. That's great. I want to know, is it cool to wear your vaccination card on a lanyard, like as like a VIP badge? Just asking for a friend.
Cool. I don't know. I do think it's important to keep it somewhere safe, and somewhere you won't lose it, but you don't need to wear it. In fact, maybe don't wear it so it doesn't get, your food, your dripping of Three Sisters.
Have it in plastic. For the record.
Well, you know what? You're a walking advertisement for getting a vaccine. If you get your vaccine, you can be just like Tai.
Oh, and be just as cool.
And just as cool.
All right, a huge Nyawagoa thank you to Dr. Bell for taking her time to be with us to answer all these questions and to answer a lot of my meaningless questions. I truly thank you for today.
Yeah, thanks so much for having me, Tai. It was such a privilege. And I know that we covered a lot, but if folks who are listening or watching still have questions, please consult one of your own healthcare providers or reach out to resources online like the CDC and IHS or your own tribal sites where people can get more information. Thanks for having me. I'm glad to be here.
That's great. And if anyone has questions about lanyards, just hit me up. Thank you.